Tell me about TM. What is TM?
TM is tetrathiomolybdate. It's molybdenum bound to sulfur. It needs to be made by a compounding pharmacy because we use it in such high doses, and it's very reactive to oxygen, so it has to be made in the right environment or it can lose its activity really easily. It was discovered because we found that sheep that ate high amounts of molybdenum and sulfur had copper depletion. And copper is, besides being essential for a lot of physiological processes in the body, cancer cells need copper in order to grow. Cancer cells can't grow more than 2 millimeters without copper. Most of the VEGF, vascular endothelial growth factors, that cancer uses are copper dependent. And we find that patients who have an active cancer process going tend to have high copper levels. While the initial studies on TM that were done at the University of Michigan were mixed when they used them on patients who had cancer, who had an active cancer process, what we found since that time is that this works particularly well for patients who have no evidence of disease. So these are patients who have had cancer, have been treated, have a very high likelihood of recurrence. This happens a lot in stage 4 patients who have metastatic disease. It happens a lot in other cancers like ovarian cancer as well. And if we can treat them at the time when they have no evidence of disease and put them on a copper chelation protocol, bring their copper levels down to target range, hold it there for a time period to decopper the cancer cells, typically 3 to 6 months, that their chance of recurrence at that point is minimized significantly. We have a group of folks who have some empirical data that they've been doing on this, and one of my colleagues who's a mentor of mine, who's actually a clinical oncologist, he has a sample size of over 25 patients right now, all stage 4 patients who were treated, no evidence of disease, different types of cancers. When they were put on TM, made it to the target range that we're looking for copper and ceruloplasmin, and held there for 3 to 5 months and stayed cancer-free. He doesn't have one patient who's had a recurrence yet. He has one woman who's 13 years out, and all of them were stage 4 patients. And as you know, that's pretty phenomenal.
It's amazing.
Yeah.
That's really exciting.
Yeah. It's as far as I know, I believe we're the only clinic in Washington that's currently doing TM therapy with our patients. And it's something I'm really excited about.
Nice.